I recognize the member for Fyzabad.
Thank you very much, Deputy Speaker, for the opportunity to contribute on this bill before us here today. That is to approve the supplementation or the media review. Before I go into the meat of my presentation, Mr. Deputy Speaker, I just wish to take the opportunity to address some of the issues raised by the Honorable Minister of Health. I noticed that the Minister of Health seemed to have lacked a bit of energy today. Perhaps he's tired, but there are a few issues that I need to address. And I just want to state, first of all, very clearly, the statement about the UNC to succeed, for the UNC to succeed, that Trinidad and Tobago must fail. Mr. Deputy Speaker, I want to say on this side that is furthest from the truth. We on this side are here to support whatever measures are required to provide for the benefit of Trinidad and Tobago. And indeed, Mr. Deputy Speaker, I want to say further that the parallel healthcare system of which the minister boasts and which would have assisted in the battle against COVID was built on a UNC foundation, Mr. Deputy Speaker, and I'll go further to explain that in a bit. I also want to address the issue of why does everyone want to come back to Trinidad and Tobago, Madam Speaker, Mr. Deputy Speaker? On a light note, the answer is simple, because they want to remove the PNM and save Trinidad and Tobago. So that's straightforward, Mr. Deputy Speaker. Mr. Deputy Speaker, I also want to raise the issue of, Mr. Deputy Speaker, of using statistics. The Minister mentioned about the decrease in influenza cases and so on. And as we speak to the national population, I think it's important that we understand that sometimes statistics are not always reliable. And when you talk about reported cases, it may very well be that because of the current situation, that those patients who normally would present to a hospital setting are not presenting. So one has to be careful in terms of how you interpret that, those statements. And the issue of the request for testing by the opposition leader, the Member of Parliament for Siparia, is based on good and valid scientific practice, and that is that you have to have the evidence. You must have a sufficient number of tests to ascertain the incidence of the crisis that you're facing, and therefore you must have the numbers before you can address the crisis. The Minister raised a very important point, which I intend to address as well, Mr. Deputy Speaker, and that is the issue of the extraordinary expenditure on a product, a drug called human immunoglobulin. And I remember in the committee stage, the Minister was concerned about the cost of that drug. And I myself became very concerned, Mr. Deputy Speaker. And you know what, let me just go into that straight away. Mr. Deputy Speaker, following that committee meeting on Wednesday, I did some research, and to quote the Minister, and he's correct in this in terms of the figures, he indicated that $100,000 to $200,000 was spent on this particular drug, and I speak of the human immunoglobulin per patient. This drug actually comes in two dosages, Mr. Deputy Speaker. There's a 1 milligram and there's a 0.1 milligram. So it's a big dose and a small dose, and it's normally given 5 doses per patient. For the big dose, it would cost about $9,000 US. For the small dose, about $2,000 US. When you translate that by our current exchange rate, Mr. Deputy Speaker, you will come to figures of about, in one case, if you use 16,000, or maybe about 60, 70,000. There are two issues here, Mr. Deputy Speaker. One is that, and I say this with the greatest of respect because, in the practice of medicine, when I wear my hat as a medical practitioner and change it for the Parliament, medical practitioners have something called, we treasure and we value something called clinical freedom. It means that, we don't want to be interfered with in terms of getting the best drug to treat a patient. And I support that, and that's important. On the other hand, as parliamentarians, we have to look for value for money, Mr. Deputy Speaker. But the point I was making is that the research has indicated that this drug is still experimental and may not be of tremendous, of confirmed value. So I spoke to my colleagues who were treating the patients at Cuba Hospital. And Mr. Deputy Speaker, I am very alarmed to learn that none of the patients at Couva Hospital who would have required this drug, or where that drug would have been used, have actually received the drug. So I want to ask the Minister here today in this Parliament, Mr. Deputy Speaker, I want to ask the Minister to look carefully at where this drug was given and whether the expenditure, was justifiable in terms of the cost that the government would have paid for this drug. And if it is that the drug was required, certainly to my information, the information I have, this drug would not have been used on COVID-19 patients. And if it was used elsewhere, Mr. Deputy Speaker, then so be it, and I'm fine with that. I have no grudge for that. But I'm just saying here that as we asked for the approval of $224 million for the COVID response for the Ministry of Health, that is something that the Minister of Health needs to look at and to get a bit more information and detail on that, Mr. Deputy Speaker. So, as mentioned in the bill, and we are looking at the committee as well, the report of the committee, the Minister did mention on Wednesday that the $224.5 million extra was required for supplementation in three major categories. That is the COVID-19 response to set up the parallel healthcare system, the loan for NIPDEC with regards to the purchase of pharmaceuticals and non-pharmaceuticals, and the construction loans for the Central Block and Arima Hospital. So, Mr. Deputy Speaker, let me look at the COVID-19 response. We were told that this money is benefiting, or would have benefited 589 persons who were treated or accommodated, 117 persons tested positive, and 8 deaths, unfortunately. And at this point, I would really want to thank the doctors, the nurses. I want to take this opportunity, and the healthcare staff, who were led, ably by the Chief Medical Officer. I also want to take the opportunity to thank those who perform the essential services, protective services, those who are industrial workers, and so on. And most importantly, of course, to thank the people of Trinidad and Tobago, who I believe did a wonderful job in doing what they were supposed to do. And this, of course, would have resulted to a large extent, to a great extent, in us being in the position where we are. And of course, I want to, thank those as well, the students who have been anxiously awaiting the writing of the CAPE and CXC and the SC exams and so on. But, Mr. Deputy Speaker, the management of this crisis by the government that happened to be in power illustrates a very important example of how responses in a time of crisis and emergency depend on foundations that are laid by previous administrations. And I want to say, Mr. Deputy Speaker, that the foundation, the parallel health system that the government speaks of, and I have no problem with that. That is a system that has worked uniquely in our setting, but this was possible, Mr. Deputy Speaker, for several reasons. And I want to go back to a meeting of the Public Administrations and Appropriations Committee in the early stages of planning for the COVID crisis. And I want to compliment the PAC for taking the initiative in terms of convening those meetings. But to say at one of those meetings, the Chief Medical Officer, when asked about the planning for the COVID-19, indicated that there was a plan prepared by the government in 2014, which would have been the People's Partnership government, to address the Ebola issue. And his job, therefore, was very easy in that all he had to do was remove Ebola and insert COVID-19. So I'm saying, Mr. Deputy Speaker, that the process, a plan was already there. Nothing is wrong with that. The plan was built upon. It would have to be modified, and so on. But I'm saying that that was a bit of a foundation. Very importantly, I want to say, Mr. Deputy Speaker, that one of the most important features of the response of this government to COVID-19 was a brand new facility, 230 beds, that was there and able to take the challenge and to deal with the challenge of COVID-19. And of course, I speak of the Couva Hospital, which came on at the appropriate time and was appropriately and adequately utilized by the citizens of Trinidad and Tobago. So therefore, that would have been one of the foundations that was built by the People's Partnership and turned out to be a great asset to the government of the day in terms of addressing this issue. So, Mr. Deputy Speaker, and of course the other foundations which would have been built, the foundation would have been laid for the Arima Hospital, which the government is taking credit for. Nothing is wrong, Mr. Deputy Speaker. It takes years to build a hospital. The fact of the matter is that the partnership, started the process, and therefore we are happy to see that it's being completed, and that the residents of Arima and Trinidad and Tobago will benefit. And I trust and hope that the Point 14 Hospital, which was started by the People's Partnership, will be delivered to the people of Point 14. That is an area that is close to my heart. I remember as chairman of Southwest Regional Health Authority, Mr. Deputy Speaker, when high-risk patients would have had to be flown by ambulance from Point 14 to San Fernando. And I look forward to the completion of that project started under the partnership government. Mr. Deputy Speaker, I just want to refer to the issue of contract employment, where an allocation of $3 million and $34,000 was allocated with regards to the 11 ICU nurses from Cuba. We're very happy, Mr. Deputy Speaker, that specialist nurses are being added to our health sector. But one of the concerns raised by the Trinidad and Tobago Registered Nurses Association is with regards to whether the qualifications of these nurses have been examined. And I say that because what is happening is that the local nurses have found that sometimes those who are brought as specialists have to be supervised and overseen by the local nurses. And I ask that the minister, ensure that these nurses are adequately qualified and trained as they treat with our citizens. And of course, with regards to the Nursing Council, I just want to digress for one moment, with your permission, Mr. Deputy Speaker, and just to ask about the legal status of the Nursing Council, because after all, they are responsible for certifying any additional staff, especially foreign staff, that we may want to engage and employ in the health sector. And there is that issue of 9 out of 16 positions still not being filled. And I ask for the minister to address that as a matter of urgency, because the question is being asked as to whether the Nursing Council of Trinidad and Tobago might be operating illegally. So to move on, Mr. Deputy Speaker, I noticed, of course, as well that the COVID hotline was implemented and 20 doctors were employed. That is commendable. But I also, ponder, Mr. Deputy Speaker, as to why the opportunity was not taken to perhaps engage more of the 500 or 600 unemployed doctors who are still currently available. So a commendable initiative, the COVID hotline, but, Mr. Deputy Speaker, I also think that there may have been a missed opportunity, and I want to throw this out because I hope I'm wrong, but COVID may still be with us when we reopen the borders, but I hope I'm wrong about that. And I therefore just throw it out as a suggestion that when you have a captive audience, as we did for the last 2 or 3 months during the lockdown, that perhaps the opportunity could have been taken to also have what I call a non-communicable disease hotline, in the sense that we could have taken the opportunity, Minister of Finance, to engage a few more doctors, and you take the opportunity, and you have this captive audience where you can educate them, but also you could have done a bit more primary health care, via the internet and the WhatsApp and so on. But it's just a suggestion I throw out, Mr. Deputy Speaker. So I want to move on, and I just want to look at the RHA allocations of $4.2 billion, which has been increased by $185 million. And of course, when it comes to health, comes to COVID, we're looking at expenditure, but we're also looking at value for money. And Mr. Deputy Speaker, I just wanted to raise the issue of one issue which has been brought to my attention, and this is regards to the engagement of nurses, of the engagement of 30 UNDP nurses who were placed in Cuba and were under the oversight of the North Central Regional Health Authority. And the issue here, Mr. Deputy Speaker, is that these nurses apparently were supposed to have been paid $13,000 by the UNDP. And the information is that they were paid $7,507 for the first 2 months. Of course, that's a big difference. And the question really has to be asked as to whether this was just administrative error or whether, in fact, the nurses were being, treated unfairly in terms of what was entitled, what they were entitled to. I also want to raise an issue here as well in terms of the NCRHA. Mr. Deputy Speaker, with regards, and we speak about the nurses and so on, and if we look at the allocation of nurses at the NCRHA, and I raise this point because the NCRHA has been given the highest allocation in terms of the additional expenditure of $185 million. In fact, they have been allocated $129,950,000. And therefore, I think it's important that we look at the issue of because they have the largest number of facilities to look after, and the numbers here, the issues here that have been raised is that, and again, this is just a comparison from the data I've received, is that at the SWRHA you have 1,250 nurses, at the NWRHA you have 1,112 nurses. But at the NCRHA, you only have 600 nurses. And the question is that, why is this so, when in fact you would need more nurses at the NCRHA to manage the facilities that are there? And I think this is something that the Minister of Health needs to look at in terms of the quality of governance at the NCRHA. And there are many issues, and I focus on the NCRHA, Mr. Deputy Speaker, because this authority, has been asked to do a whole lot. They are being given the biggest allocation, and there are questions being asked in terms of governance. And, I want to ask, again, the Minister may or may not be aware of this, but I want to ask, was a senior hospital administrator sent on leave because they refused to sign off on an invoice that required, and apparently this invoice was required to, the administrator was being asked to approve an invoice which he felt, was not appropriate in terms of tents being rented at the NCRHA. So the question is, was this hospital administrator, is he currently on leave because of that? And also, there's also the issue of a hospital medical director who was appointed to Cuba Hospital at the height of the crisis, and who left the position after 2 weeks, allegedly because of pressure, from senior administrators at the NCRHA. So I speak of these matters because it's a matter, of governance. It's an issue, that speaks to governance. It's an issue that speaks to whether this allocation that we are being asked to approve of here in this Parliament today, Mr. Deputy Speaker, whether the country, whether our citizens are going to get value for money, whether there's going to be accountability, whether there's going to be transparency in the expenditure of these funds. Mr. Deputy Speaker, I wanted to also refer, as the Minister mentioned, one was the issue of the COVID-19 response, but the other big item that we have been asked to approve here has to deal with a NIPDEC loan of $671 million, and this is 04011105, a NIPDEC loan. And I go back to this, Mr. Deputy Speaker, because in the in the October 2020 budget, there was something that troubled me tremendously. Because in the budget presentation, under the item for drugs and supplies, Mr. Deputy Speaker, there's a special item that speaks to drugs and supplies. And in 2019, the expenditure on that item was 575,162 million. And I'm familiar with the expenditure under that item, Mr. Deputy Speaker, because I monitor it. I've looked at it over the last 5 years, and it's normally around $600 million. But the allocation in the 2020 budget was $144,200,000. So there was a shortfall of $430 million in that allocation. And I remember raising it at the Standing Finance Committee phase, and we got an answer that the shortfall will be made up. It has been made up, and this is where this NIPDEC loan speaks to. The problem I have, Mr. Deputy Speaker, is that that loan was only approved on the 1st of April, and 262.5 million, the minister advised, has been dispersed. And therefore, I am seeing that there would have been a gap in the distribution of drugs and supplies, and because I'm looking at the period from January to March of 2020, because the October allocation would have probably just lasted the first quarter. So I'm very concerned that how that gap was dealt with, and whether patients would have been affected at the hospitals because of a shortage of drugs and supplies during that period whilst this loan was being negotiated. So, Mr. Deputy Speaker, I'm asking that the minister address this issue, what would have been the impact of the shortfall on drugs and supplies, especially in the second and perhaps the early third quarter of financial 2020. The other issue that is of concern would be I just want to refer to the ERHA loan, which was increased from $500 million to $1 billion. And we are told that although it's linked to the ERHA, it was really meant to treat with expenditure across the ERHAs. And the ministers indicated that these were mainly for trade payables. And that's fine, it's important. But again, if these are outstanding trade payables, the question really would be, what was the impact on suppliers and supplies in the health sector? And perhaps this is something that that needs to be addressed. So, Mr. Deputy Speaker, there is the two more issues I just want to look at with regards to the matters raised. And this would be the issue of COVID testing. I come back to that. The minister indicated that close to 3,000 patient tests have been done. In fact, he stated 2,952. Fortunately, just a small number of those were positive, 117. And we know that CAFA was involved in the testing. But with regards to the actual testing, Mr. Deputy Speaker, there would have also been significant involvement of the Trinidad Public Health Laboratory in the matter of testing. And there are some issues which I want to raise with regards to the TPHL. Now, they would have been part of the process for getting the samples to CAFA. But we are also seeing a situation here, Mr. Deputy Speaker, of many issues with regards to the Trinidad Public Health Laboratory. And I'm hoping that these can be addressed, especially in light of the fact that we are asking for additional funding. We are asking for additional allocations here. And some of the issues that have come to my attention, and I want to raise this with the minister, perhaps to look at whether this can be corrected, is the issue, first of all, of, when I speak of the Trinidad Public Health Laboratory, the issue of not getting testing kits, for example, for hepatitis B, for hepatitis C, for HIV reagents, for what you call torch titers, and for herpes. In fact, my information here, and this is current, is that there have been no HIV kits available for the last 2.5 months. Also very worrisome is the fact that no preventive maintenance, or very little maintenance has been done, to this lab. And, the staff there feel that, that whilst CAFA has been praised, they are being sidelined, and they have some genuine issues, They have very important role in terms of the procurement and distribution of swabs, to recording, liaising with CAFA and so on, and sending out the reports. And initially my information is that they had 7 fridges and 7 freezers in 2018. And, Mr. Deputy Speaker, my information is that they are now down to 1 lab fridge. So this is very worrisome. And perhaps, the government may want to look at this and address this if this is in fact correct. And, it's worrisome that apparently Standards Furniture Store had to donate 2 fridges to the facility, and 2 with ice makers to the UWI lab. And one of the important things to note is that regular refrigerators are not adequate and appropriate for storing and dealing with laboratory materials, because the temperature and so on is very important. But the significance of this is that if you don't store these reagents and testing kits at the appropriate temperature, it means that they have a shorter shelf life and they can go bad. But most importantly, the integrity of your tests could be compromised. And you would remember, Mr. Deputy Speaker, that there was some issue as regarding the integrity of some tests in the public domain during the early stages of the COVID crisis. And I would hate to think that this would have been an issue that would have caused this. So I just wanted to bring this to the attention of the government in regards to what is happening at the Trinidad Public Health Laboratory. So, Mr. Deputy Speaker, as I close, I just wanted to mention there's one more issue, and that is the issue of the expenditure that has been allocated to the TRHE. And I have nothing against, it's always been a difficult situation, Mr. Deputy Speaker. I remember, as chairman of Southwest, we would have meetings convened, and the chairman of the TRHE would be invited as well to join those meetings, although the administrative arrangements are different. But I just want to make an appeal and to ensure that the expenditure of that $50 million is spent properly. And some of it is for infrastructure, and I know the Minister of Finance had promised to give some details. Perhaps in his wind-up he might be able to give some specifics as to how that allocation will be done. But I also want to ensure that the money that was allocated for infrastructure is in fact done properly and completed on time. I think it's important. I have no grounds with it, but I also want to ensure that it's spent properly and in line with the battle against COVID-19. So, Mr. Deputy Speaker, I thank you for the opportunity. As we look to COVID in the future, this morning it's good news in the sense that I saw a report of a patient being saved by a double lung transplant. That is very encouraging. This is a patient who would have survived. But at the same time, we see today that the numbers have grown past 7 million. And of course, we look forward to a vaccine, because with the development of a vaccine and the implementation of a vaccine, we know that is where it will change the dynamics. So, Mr. Deputy Speaker, with those few words, I thank you for the opportunity. Thank you very much.